Hello everyone, very good morning. At first, I would like to thank World Bank and George Washington University for inviting me to actually share our work, how AI is transforming healthcare in low middle income countries. Today, I would like to present our framework for AI-driven healthcare triage to improve health access and affordability in low middle income countries. Healthcare in many LMIC countries are very similar, and healthcare professionals or providers are very limited. If I talk about the context of Bangladesh, only 10 doctor, nurse and paramedics are available for every 10,000 population, which is way lower than the world standards, which is 48.6. Most people don't know where to go when they are sick. There is no systematic things for triage and referral systems. And most importantly, around 65% population get healthcare from informal sector, and all of these things leading to misinformation, diagnostic delay and delayed care. If I go more detail into it, the situation could be much worse. In many LMICs, 63% people do self medications, even antibiotics, and which create huge antibiotic resistance. In Bangladesh, 67% antibiotic dispenses from unqualified providers without prescription, and the number is much worse when we see that 45% Bangladeshis are at least one antibiotic resistance, and the situation is getting worse every year. Last 5 years, 11% AMR raises, and the effectiveness of antibiotics is reducing over time, and which goes to 82%. And overall, 25% people in LMICs actually dying due to AMR, and this will be the next pandemic we need to face. We are living in era of artificial intelligence, which transforming our whole life, where we live, from business, from education, health and everything. Today, we would like to share with you that we motivated to build a AI-powered clinically validated health risk assessment, triage and referral system which can empower individuals, healthcare providers to navigate right healthcare at the right time, utilizing all the things of AI. The AI engine have a system that includes health inclusion, that creates health account for every citizens. It monitors health, provide preventive and primary health care, build electronic health record and follow up. And it embedded with risk assessment protocols which developed through clinical decision support system and machine learning models. And combined with it, there is a triage and referral system which combines large language model and machine learning. And most importantly, to improve the education and awareness, a Gen AI based or LLM based system to educate and awareness and provide optimal guidance to get right healthcare on a right time. The most important thing is the design and development should be inclusive, and that's why we created a multilingual, multicultural solutions, and which should be clinically validated both dataset and the AI engine. And we need to work in a developing world where technology is not evenly distributed. We need to go deep rural areas where internet penetration is very poor, and that's why our solution should be offline and online. Together, this solution can bring accessible, affordable healthcare with the support of artificial intelligence so that everyone can get healthcare anywhere, anytime. It also creates the medicine adherence, which helps to use rational medications and reduce the antibiotic resistance. And most importantly, due to stigma and taboo, people are not very much standards to understand that. So therefore, Gen AI based or medical GPT based education awareness is very important. Overall, an AI platform to transform healthcare to actually give preventive and primary healthcare, early identification of the risk and early intervention to reduce bad healthcare consequence. Now, if we come to the methodology, there is a three major part: creating the clinically validated data set, creating the model which is combined with machine learning and large language models, and real life evaluations and implementations. So here we try to see two angles. One is, what are the demographic information like age, gender and so on. What is my complaint? What are the symptoms? How many days I am suffering? And what is the severity? Based on all of the data, system can do two things. One is giving the right information, right risk assessment, and navigating for right resources, which is called referrals, and giving the education and adherence so that we understand we need to go to the doctor or we need to observe or it is an emergency. The whole systems need to be trained and evaluated with a real life implementation, of course with a very standard clinical validations. So with that we created our data set, which includes, as I said, demographic informations and the complaints, severity and the decision making. So in that way we actually building a clinical validated knowledge base and creating a cases of all the combinations of the situations. Think about it, everyone having a different types of health conditions. In that way we actually gathered information from national and international sources and clinically validated and build a combination of 130,000 unique scenarios of patient cases and standardize all this data for machine learning models and large language models. And of course all the data set are clinically curated and validated by 3 independent clinical teams. And this is where our models comes up with a ensemble based machine learning based models and the LLM based models. In these two models we independently designed, developed and evaluated to understand the patient information, patient history and their demographics and make recommendations. And I would like to share with you our first result with a 247 patient scenario we actually evaluated, and we found that our machine learning based ensemble model, which uses structured clinical data and got around 95% accuracy to give the recommendation. On the other hand, when we use LLM based solutions and unstructured data, and our results got an 81%. It sounds that LLM is actually less perform than machine learning based model. However, when it comes to the human are more oriented with the LLM based model, which is more natural. So now we are trying to combine these two solutions to make the solution more effective, more inclusive and naturalistic. And that is where we are working, and this is our architecture. So now the question is, how are we going to implement it? We build a Sushasto.ai, which is called goodhealth.ai, to create a health inclusion at the doorstep of the people. It empowers individuals who have a smartphone and educations. It also empowers community health workers to go to the doorsteps, to create digital front doors to getting the healthcare service for everyone, give periodic health education, screening, risk assessment, referrals and educate them how they can use it all the time when they face challenges. And it uses core AI engine to do the risk assessment and triage and creating an impact. You can see here that the solution actually empowering the user and the community health worker with a combination of machine learning and large language model to make the decision that your healthcare problem is not very big, you need to observe it, or you need a doctor attention to connect to the telemedicine, or you need to go to the emergency. And the data help us to make the decisions and improve the healthcare service delivery. Now, such kind of solution can have a huge impact in developing world. It empowers every individuals, every healthcare providers to ensure preventive and primary healthcare with the power of the technology. It helps people to understand the medicine use and antibiotic adherence and reduce the AMR. And most importantly, it can reduce the cost because it periodically understand the health risk and like identify the health conditions and make the early identification and early interventions. And one of the big challenge in developing country that many diseases like cancer, stroke, heart attack identify very late, and that time it was very difficult to manage. And in that context, what actually happened? Many families go to the poverty line. And why? Because long-term healthcare cost is very difficult to bear. and in many LMIC countries there is no health financing schemes. So with these solutions it can really help to reduce the catastrophic health expenditure and especially managing non-communicable disease and improving the maternal mortality. Now I would like to share with you what challenge we are going to face when we are going to one LMIC country to another LMIC countries. You can imagine that every country, their demographics and social context is different. So in our solution, when we go for a scale, we must need to address it. This is one of the challenge we have to face. And next challenge is, you know that large language model requires huge computational power, and we need to actually adapt it. For country like many LMIC, that computational resources is very limited. So this is one of the constraints we have. And finally, every country we go, every culture we go, we must need to actually gather the data, improve our knowledge base and develop the model, and which should be clinically validated for every country and every context. So that requires funding to do that. So we are actually envisioning that with our work and support from our collaborators, we can develop a hybrid model and deploy it and pilot and test it with our industry partner CMED Health. And we can ensure equity and inclusivity for all and ensure data privacy and security. And our goal is to create more advanced risk prediction, like predicting different kinds of cancers, stroke, heart attack, kidney disease or any emerging diseases early, so that we intervention early to reduce the healthcare consequences. And we also want to have a predictive health analytics, health monitoring, tracking and behavioral change in LMIC country people where 7 billion people live. And we want to optimize it through the technology and large language model to ensure healthcare is a right for all. In conclusion, I'd like to share that what we can achieve so far. So we made a clinically validated dataset and also developed our AI model using Ensemble classifier, which got 94% accuracy. We are now working on the hybrid model with large language model, and we want to have an immediate access to affordable quality care on their fingertip and promote rational use of medicine, especially educating people use of antibiotic and reduce the AMR. And together we want to utilize the technology power of AI to create equitable healthcare and promote health equity and reduce the barriers of access to affordable care. I would like to thank our funders, United International University and Higher Education Acceleration Transformation Project of Bangladesh government, and our industry partner for their support to build this solution. And we impacted around 4 million people with our different healthcare solutions. These are the references which could be useful to explore, and we are looking forward to collaborate with everyone, because we believe healthcare is just not a service, it's a human right. Let's deliver it together to make healthier future. Thank you.